Welcome to Biztechasia Health and Wellness Show. Now, our guest today is Dato Professor Dr. Adeeba Kamarulzaman. Professor Dr. Adeeba has been a driving force behind mitigating the spread of infectious diseases such as HIV/AIDS and has been instrumental in structuring policies and responses that have led to the prevention, treatment, and reduction of HIV and AIDS cases for over 30 years. Now, to tell us more, welcome to the show, Professor Adeeba.
Thank you very much, Brian. It's a pleasure to be here.
Now, Professor, for a start, could you tell us a little bit of yourself and your journey to becoming a doctor?
Well, I was not one of those people who always knew that I wanted to be a brain surgeon. I happened to do well at school, was sent on a Malaysian government scholarship to Australia, made the marks, and then thought, well, maybe medicine is for me. Then I went to Monash University to do medicine and continued on in Australia to be trained in internal medicine. At the time, infectious diseases and HIV/AIDS in particular, this was in the late 80s. I graduated in 87, so late 80s, early 90s. There was a lot of interest in HIV/AIDS, and that became, so infectious diseases became my chosen subspecialty in internal medicine, because I really worked with some very inspiring colleagues, senior colleagues. And here I am, after studying and working in Australia, in Melbourne in particular, for about 15 years. My husband and I decided to come back to Malaysia and give back, I guess. So here we are, 20 odd years later, 25 years later to be exact.
Okay, so what was the catalyst for you to turn from really being the student and the medical practitioner into the giver? And when I say giver, a couple of things you've done. First, you made the decision to come back to Malaysia. And then after that, once you came back to Malaysia, for example, set up the infectious diseases unit at the University of Malaya. You also set up the Center of Excellence for Research in AIDS. Tell us about what was that turning point.
Well, the decision to come back was not very difficult. First of all, for family reasons, as always. And secondly, I owe the government of Malaysia, they've given me the opportunity to study and train in Australia. So at least temporarily, I had to pay back. And so we thought, we have one foot in each country. We didn't like it. We could always go back later on. But like I said, 22 years later, 25 years later, here we are. The field of infectious disease and HIV/AIDS in particular has a unique kind of ability to suck you in, if you like, because it's not just about biomedicine. It's not, there's a whole, you really need to look at the person and the whole issue in its totality, from what puts people at risk to, what differentiates whether someone has access to treatment and all of that. And once you get sucked into it, it's very hard to turn away, if you like, because you start seeing it from more than just the medical angle. And that's how I then got involved with prevention, particularly amongst people who inject drugs. And as you learn more about it, you realize that the whole issue is so complicated. Then I start working on drug policy reform and research projects in Kajang prison and so forth and so forth, because truly you just can't turn away from it. One thing leads to another, to another, to another. And I guess that's what made me want to give. And the other aspect of it is I enjoy seeing my junior colleagues get involved and then become leaders in their own right. I think that's the other reason, you know, I kind of established the research centers and the units. So it's not just about me, that we have a team working on things either clinically or in research.
Now, Professor Adeeba, I want to ask you this because, as you said, you have a little bit of a foot in both countries. And so you have a global lens as opposed to a local lens, because you are recognized, for example, as one of the top 20 scientists, medical scientists, Islamic medical scientists in the world. Where is Malaysia, and where does Malaysia stand from a public health perspective in combating HIV and AIDS?
Well, I think part of the reason I got the global recognition, and I've just stepped down as the president of the International AIDS Society as of a week ago, which is the largest organization of healthcare professionals with over 16,000 members in over 160 countries. As a result of our advocacy and our work in trying to reverse the HIV epidemic in Malaysia, particularly, like I said earlier on, when it was amongst people who inject drugs. So, you know, Malaysia led the way, we advocated, but ultimately it was the government of Malaysia that gave the green light for the needle syringe program and opioid agonist treatment for people who inject drugs, which has very successfully turned around the HIV epidemic in Malaysia from, you know, an average of 6,000 new infections reported annually back in the early 2000s to now, well, amongst people who inject drugs, to less than 500 people a year. So we've made this remarkable turnaround, and my colleagues and I have also looked at, since you are a business show, we've also, together with colleagues from University of New South Wales, Yale, and the World Bank, we also looked at the return on investment in this. And, you know, we in the 15 or so years of this program, we've probably saved the government of Malaysia, I think, something like 70 million ringgit. I need to go back. It's quite an old study, but we have significantly saved the government in terms of healthcare cost. So we have managed to turn it around. The other success that Malaysia has had is in eliminating mother-to-child transmission for HIV. This is, you know, a significant achievement as well. Unfortunately, in the last few years, and this was borne out in the report that was released at the AIDS 2022 conference in Montreal last week that I chaired, we are one of the few countries in the region, together with the Philippines, Pakistan, Papua New Guinea, I think, and Indonesia, that's seeing a rise in the number of new infections. In Malaysia, and for Malaysia, the mode of transmission now, rather than injecting drug use, because we're now providing clean needles and syringes, is through sexual transmission, particularly amongst men who have sex with men. So there's a lot of work to do to bring those numbers down again, but I'm confident that if we work together, we can.
Now, Professor, one of the interesting things that I found out was the fact that, unlike a lot of other governments, even in some Western and more advanced, richer countries, for example, like Singapore, the Malaysian government actually provides free or near free treatment for sufferers of HIV AIDS. Is that correct?
Yeah, and I think this is again something that we can be proud of. For our level of income as a country, we have really funded both the treatment and prevention programs to the tune of about, I think, 95% as domestic funding. We have had over the last many years some support from the Global Fund for AIDS, TB, and malaria, but by and large, most of our programs are funded domestically, including, as you mentioned, free treatment, free first-line treatment for Malaysians as soon as they need it. That this treatment is for life, right?
That's right. AIDS is now a management thing. You can manage the disease.
Correct.
Now, then what can be done then to increase awareness among the general population? Because what you just mentioned earlier, worry is very worrying. The fact that rates of infection are actually increasing.
So I think, one of the mantras in the HIV world is know your epidemic, know your response, meaning, we need to take stock of who and where the infections are more common. And in our case, it's among young people, particularly amongst men who have sex with men. In contrast, for example, in sub-Saharan Africa, the infection is more common amongst young girls and women. So, but in our region right now, it's including Malaysia, it's amongst men who have sex with men. And so we need to craft our programs accordingly. I think it's important for to have ongoing general awareness around HIV/AIDS, but more specifically, particularly in current resource constrained era for health, that you focus on who are the people who are most at risk and tailor your prevention programs accordingly. So, for example, what we are doing at the Malaysian AIDS Council is reaching out to these people who are most at risk through a web-based information, as well as they are able to order self-testing kits online, have the tests at home, share with us the results, share with the team the results, and we will channel them into treatment if they, or for confirmation and treatment if they test positive, or channel them to prevention programs, otherwise known as pre-exposure prophylaxis. So that's one example of kind of tailoring your prevention programs accordingly. The second is to really work with peers. So it makes more sense to work amongst networks of, for example, men who have sex with men, to deliver the message, to even deliver the prevention and treatment programs. And these have been proven scientifically to show that it's more effective.
Professor, I've got to ask you this: what has kept your passion burning for all these years?
I think it's a number of things. First of all, of course, it's at the individual level. It's incredibly humbling and fulfilling, I guess, to see someone, for example, someone who's come in ill, and you're able to give them back their lives without sounding so dramatic, with the very effective treatment that we have. Secondly, I think to be part of a global movement of people who are extremely passionate, and this was borne out in the AIDS conference in Montreal. I think, throughout the 5-day conference, we were having advocates and activists demonstrating throughout the conference. It was a headache for me and the conference organizers, but in the end, it showed the passion and made the noise. So it's incredibly, again, exciting to be part of this global movement of really wonderful people. And it's not just doctors and scientists, but community workers and advocates and activists. And thirdly, I guess that the science excites me. The fantastic advances that we've had in the last 30 years. I trained when there was no treatment. Patients were dying right, left, and center around me. And now we have treatment that not only allows someone living with HIV to live a normal, healthy, productive life, and normal lifespan compared to someone who's not living with HIV, but also that if if they achieve what we call undetectable viral levels, that they will not transmit the infection onwards to their sexual partners without wearing condoms. The concept of U equals U, or undetectable equals untransmissible. So the other major advance that we've had is this pill that, if given once a day, can reduce the risk of infection by more than 90%. And now we have injectables that can do, to prevent HIV infection very, very effectively as well. So this constant sort of advances is to, and which will lead, inshallah, to the end of AIDS by 2030 as a public health threat is very inspiring and very exciting to be a part of.
Now, Professor, I'm deeply humbled to have the opportunity to interview you, and I've learned a lot during this conversation. But before we leave, any final words of or thoughts that you'd like to share with our audience before we end the conversation?
So, Brian, since we've been talking a lot about HIV/AIDS, I have a gazillion and one things to talk about health in Malaysia in general. But since we've been talking about HIV/AIDS in particular, I think globally the alarm bell has been sound. We've made incredible progress in the last 30 years to really reverse the trend of global HIV/AIDS pandemic, but in the last couple of years, the decline has stalled, and that's also reflected in what's happening in Malaysia. But I think it is really a disease that we can, compared to 30 years ago, that we can overcome if we work together, if we follow the science. The tools are there, whether it's treatment or prevention. Tinggal lagi, as we say in Malay, we have to implement them to scale. And to do that, like with COVID, we need to work together. We need to bring communities with us. We need to, all the healthcare professionals and scientists need to work together, policymakers with the community. And we can do it. Countries less advanced than us, namely this year, we're again at the AIDS conference, we were celebrating Botswana. Imagine Botswana with a prevalence of 20% has reached or surpassed the goals of what we call the 95, where 95% of people living with HIV know their status, been tested, know their status, 95% are on treatment, and 95% have achieved undetectable levels. So if Botswana can do it, Rwanda can do it, so can Malaysia.
Fantastic. On that note, thank you very much for taking your time to be on the show, Professor.
It's my pleasure, Brian. Thank you. Thank you for having me.
I'm Brian Fernandez, and we've been speaking to Dato Professor Dr. Adeeba Kamarulzaman, the Professor of Medicine and Infectious Diseases at University Malaya and an adjunct associate professor at Yale University, on Biztechasia Health and Wellness Show. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. It can also be viewed on our syndication partner platforms, which include TV, radio, websites, and social media platforms. Thanks a lot for tuning in.